All right, so now we're going to talk a little bit about some basic ventilator terminology and also some of the modes that you'll likely be encountering, with the majority of the patients being on a volume-controlled mode of ventilation, and then sometimes as they get nearer to extubation or trialing extubation, considering pressure support ventilation. That's about 90 to 95% of the ventilator modes we use around the medical ICU. And some may differ on that percentage, but I'm going to give that a rough estimate. So let's talk a little bit about some vent terminology. In the previous video, we were talking about just some of the normal breathing volumes. Now we're going to talk about some of the normal ventilator terms that you might hear. I'm going to start off with PEEP again, because people often have a question about that. Because oftentimes on a ventilator, you guys are setting FiO2, tidal volume, respiratory rate, and PEEP. And these are sort of the buttons on the ventilator that you control. The PEEP is positive end expiratory pressure. Once again, positive end expiratory pressure. It's the pressure that is present at the end of exhalation, at the end of a breath on a ventilator. Now, graphically speaking, if I was talking about airway pressure here and I had PEEP, right, and these are increments of centimeters of water pressure, here's 5, 10, 15, 20. When I set a breath and I set a PEEP, then I basically have a background of pressure kind of there at all times at 5. And during a breath, pressure will rise and come up like this and then come back down again. But it won't go below this 5 if you set PEEP at 5, because that's basically what's going to be present at the end of a breath, but in the background it's there. So I think the positive end expiratory pressure is an amount of pressure that is maintained on the ventilator even at end exhalation. Now this is important for some of the ARDS patients, or acute respiratory distress syndrome patients that we get, because the alveolar air sacs are wanting to collapse. And when they do that, by applying this pressure at the end, we think we can open them up and kind of keep them distended somewhat. It's kind of like when blowing up a balloon. It's very difficult to blow up that first breath, but if you already have one breath in it, it's a lot easier to distend. So this PEEP is able to help for that. And once again, that's positive end expiratory pressure. All right, moving on, we've already talked about FiO2, tidal volume, and respiratory rate. Let's talk about some of the other parameters that we can look at. Now, a degree of hypoxemia can be determined by what we call a PF ratio, or the PaO2 from a blood gas to FiO2 ratio. So if we take a blood gas, right, and just take a look at some normal numbers, an arterial blood gas, we usually are going to report it in this order. A pH of 7.4 is about normal, and that would go first. Then the PaCO2, the amount of dissolved carbon dioxide in the bloodstream, a normal for that would be about 40, give or take a little bit. And then the PaO2, and these are all little a's because we're talking about obtained from an arterial site, such as the radial artery. PaO2 will say about 95. And this is the dissolved amount of oxygen in the bloodstream, not bound to hemoglobin, but just on its own. So a normal ABG would be 7.4, 40, and 95, representing the pH, PaCO2, and PaO2 respectively. If we take all our PaO2 from our blood gas and plug it into this equation and divide it by our FiO2 as a decimal, we can get this ratio. So normal, right, we said P little AO2 is going to be about 95, and we're going to divide that by FiO2 as a decimal. Once again, FiO2 on planet Earth is 21%. Our PF ratio is about 450. Just speaking about some general numbers here, if you have acute respiratory distress syndrome, you have bilateral chest x-ray infiltrates that's not from heart failure, and you have severe enough hypoxemia that drives this P to F ratio to at least below 300, then we can sort of classify ARDS patients into mild, moderate, or severe based on if that PF ratio is less than 300, less than 200, or less than 100 for mild, moderate, and severe ARDS. Okay, since we're on the topic of ARDS, real quickly, we were talking about the acute respiratory distress syndrome, and that should have bilateral chest x-ray infiltrates, hypoxemia, like we mentioned over here, and not from heart failure, or pulmonary edema from a cardiogenic source. That's more of an exclusionary criteria. So there's some numbers, at least for PEEP, a PF ratio that you hear because we help to diagnose ARDS and classify it with that PF ratio, and there's some normal arterial blood gases.